It is my privilege to welcome you all this morning for the lecture on Role of Biostatistics and Research Methodology in Health Sciences. Ronald Fisher said, "To consult a statistician after a project is finished is often merely to ask him to conduct a post-mortem examination. He can perhaps say what the experiment died of." And that is indeed what we aspire to provide through our program, that statistics and methodology for any research project should always come first rather than the last. Biostatistics is a branch of applied statistics and must be taught with the focus being on its various applications in biomedical research. It's an essential tool for medical research, clinical decision making, and health management. Inappropriate statistical methods, technology, and analysis result not only in loss of time and cost, but importantly from perspective of scientific ethics does harm to science and humanity. Thus, lecture for today is being organized to understand the importance and role of biostatistics and research methodology in health sciences. We are privileged to have in our midst Dr. Mark A. James, Professor and Chair, Department of Biostatistics, Environmental Health Sciences and Epidemiology, Kent State University, Ohio, United States, who has consented to be our guest speaker. On behalf of Department of Public Health Dentistry, I, Dr. Charuk Rana, welcome you, sir. I also welcome Mr. Nitin Wadhwa, Kent State, Ohio, License Office, India, the collaborating partner to SGT University. I also extend a very warm welcome to Dr. T.D. Dogra, Professor, Anthropology and Education Philosophy and Professor Emeritus of Forensic Medicine Sciences, Dr. M.S. Sidhu, Dean Research and Development, Dr. H.S. Grover, Dean Education, Examination and National and International Affairs, Dean Faculty of Dental Sciences, Dr. Anil Gupta, and all heads of various departments, professors, colleagues, and my dear students for joining us. To make this morning a blessed, one invoke Goddess Saraswati by kindling the lamp of knowledge and wisdom. And to inaugurate the function, may I request all the dignitaries to kindly light the lamp.
It's an honor to be standing at this august podium and introducing today's guest speaker, Dr. Mark A. James. Health is a universal phenomena and dynamic in nature, which needs a constant introspection at our ends as healthcare professionals. Dr. Mark A. James is an apt choice as a resource person today because of his immense contribution to public health over a long span of his career. Dr. James is a professor and chair of the Department of Biostatistics, Environmental Sciences, and Epidemiology after serving the College of Public Health as founding dean at the Kent State University. He also is an executive director of global health programs there. Previously, he served for almost 21 years as a faculty at Tulane University School of Public Health and Tropical Medicine, where he was responsible for academic programs in public health and also for recruitment, management, and evaluation of policies and procedures for faculty in their tenure, clinical and research tracks across various disciplines. He also served as the chair of the Biomedical Institution Review Board that reviewed human subject research protocols at Tulane. Presently, he is also a member of the Kent State Institutional Review Board. Dr. James has received numerous honors for his teaching effectiveness. Dr. James has maintained an active research program in immunity to infectious diseases. His prominence in the immunology of malaria is internationally accepted. He currently serves as the chair of Scientific Advisory Group for the National Institute of Health supported Latin American Center of Excellence in Malaria Research. With many more scholarly, creative, and professional activities to his name, Dr. James is an academician for all of us to gain knowledge and experience from today. And I'm sure Dr. James would also feel the academic strength and potential of our august gathering today for a fruitful interaction during his guest talks. Without taking any further time at the podium, I welcome our guest and all the delegates for a fruitful day of interaction. I also welcome Mr. Nitin, who on behalf of Kent State University India Center is our collaborating partner for today's event. Thank you.
So, without any further ado, may I request our guest speaker for the day, Dr. Mark A. James, to kindly come on the dais and enlighten us on the role of biostatistics and research methodology in health sciences. May you all have an engaging and enriching session ahead.
Okay, I'll tell you when this is. Welcome everyone. It's a real pleasure to be here at SGT University. It's my second time in India. I came first time in 2012, but this trip has been better than I ever expected. And so far this is the highlight of my trip, to visit your esteemed university. I'm hoping that this visit can result in formal international partnership between our two universities, which will enable bilateral exchange for faculty and students alike, for your students and faculty to visit Kent State University, and for our students and faculty to come here as well. A little bit, in addition to the introduction, as of July 1st, I've taken on slightly a new position, new role. My title is Associate Dean for Diversity and Global Health. So that's perfect for this kind of visit. Global health is a passion of mine. I've been involved in international research for all my career. As was mentioned, my focus has been in the immunology of malaria, primarily in Latin America. That's been my geographic focus. So as part of my new role, I'll be responsible for recruiting international students, developing partnerships, and the like. So I look forward to further interactions with your university. I'll be giving two talks today. The first is the Biostatistics and Research Methodology. We need to go back, I think, a little bit. Okay. I'll open it up for questions after we finish. Okay. Why do we care about statistics and public health? It's important because we have to be able to judge, based on evidence, the reliability of what we found in our research studies. And so this is sort of a cartoon that represents the different aspects of stress, fatty foods, risk factors, if you will, and then what does that cause? And then finally, does that have effect in children, rats, women, etc., according to a report released today? Well, it's confusing, right? It's confusing. So what we have to do is to establish studies that clarify the importance of research studies. In order to determine true relationships, we must know how well was the study designed and carried out. Were the statistical methods appropriate? What are the assumptions that they make? Now, the biostatistician will not work alone in this regard. The biostatistician is a valuable member of a research team, but as we see in the next couple of slides, the biostatistician will be working closely with epidemiologists. How generalizable the results to a similar general population? The sample versus population. Well, you want to ensure that the sample size is sufficient, the power of your study is sufficient to get reliable results and significant results. What effect do other factors make or have? And these are sometimes known as confounding variables or confounding factors. So we need biostatistics for all of this. And as you indicated, biostatistics is an applied science as part of medical and clinical sciences. So the definition of biostatistics is the science of obtaining, analyzing, and interpreting data. So by obtaining, we manage data, We analyze it and then interpret it in order to understand and improve human health. The key discipline, as was mentioned, is in the health sciences, application of statistical principles in medical and public health research. And I want to point out that this source was from the University of North Carolina, Gillings School of Global Public Health. So a number of schools of public health in the United States have realized the importance of global health, okay, and really beyond the purpose of this talk to tell the difference between public and global health, but global health is very important, particularly in North Carolina, but in my former university, Tulane University, if you go on the website and look at all the departments, each of the departments most probably have global in their name of their department. So we always say global health is local health. It depends on the location rather than the scope. What do biostatisticians do? They design health studies prior to data collection, decide what data need to be collected, retrospective versus prospective. But I want to caution you, and I'll bring this out in the second talk, both retrospective and prospective studies need to be approved by the ethics committee or the institutional review board. So some people believe that since the study is no greater than minimal risk, then local review by ethics committees is not needed, but that's not the case. Oftentimes in retrospective studies, you might be doing retrospective analysis of medical charts, of data that were collected for clinical purposes, but you can also review these data for research purposes if the data are de-identified without personal identifiers, and most generally these data are at very low risk because you no longer have contact with the patient population. Analyze the data to describe and evaluate the results using proper statistical procedures and techniques. So the biostatistician will know which methods are appropriate in analyzing the data. Interpret the results to make conclusions for researchers and other decision makers. That's important because you need to inform in one way or another. If you're working in a hospital study, you need to inform the stakeholders, which are your patients in the community, okay? So you need to be able to translate the results from the research team to other researchers to the general public. And you might start with publication in peer-reviewed journals, but yet you have to disseminate the findings to the public, including the human subjects that participate in the research. That's important. But biostatistician is a valuable member of any research team. And by the way, we are looking for students in our MPH program that want to become competent biostatisticians. And that's one of the strengths of our College of Public Health, in particular biostatistics and epidemiology. So if you're a physician, if you're a dental surgeon, we welcome you to consider an MPH at Kent State University. So, my next slide, students in the MPH degree program become highly skilled professionals in the quantitative health sciences. We have the famous Cleveland Clinic, 40 miles away from Kent, Ohio, in Cleveland. And they have a quantitative health sciences unit that helps their scientists, helps their physicians carry out and analyze data in their research studies or in their clinical trials. Our graduates are readily employed by research-intensive universities, healthcare systems, pharmaceutical companies, and large medical insurance companies. So there's a high demand for biostatisticians in this regard. Our biostatistics and epidemiology students are hired within a couple of months, if not at the time of graduation, as data analysts. So there's not a problem in finding a job for these particular students. So biostatistics is a noted strength of our college. Next. Biostatistics is used to determine how diseases develop, describe how diseases progress and spread, identify risk factors, identify and develop treatments for diseases, and estimate the effects. We have a new concentration at the undergraduate level called Clinical Trials Research. And this is going to be a very important concentration for our undergraduate students. It's normally, our target population is students that were in our preclinical concentration, which could be pre-medicine, pre-dentistry, pre-osteopathic medicine, pre-pharmacy. But as you know, only the cream of the crop actually make it to those professional schools. However, the other students need to have a track to be competent professionals as well. And that's for this reason we had developed the Clinical Trials Research concentration. Not only do they get the coursework at Kent State University, but they can do internships, like I mentioned at the Cleveland Clinic, in the Heart and Vascular Institute. In addition, these students can become employed at the Cleveland Clinic after graduation. So we have this track already established, which is a real plus. I would also like to say that we have a similar degree forthcoming in fall of 2018. It's an MS in Clinical Epidemiology. And this would be totally online. So if you have students or you'd like to enroll in this program, you have something to look forward to on an online degree program at Kent. The number one industry in Northeast Ohio is healthcare. And I've repeatedly mentioned the Cleveland Clinic, but there are other hospital systems in the region, in Cleveland or in Akron, Ohio, that are associated with healthcare that will allow our students to be interns, allow our students to develop practicum projects at the level of the master's program, and become employed later on. So this is a real plus and I would say a carrot for those of you who would consider studies at Kent State University. Our MPH program basically is such, outlined as such. Specifically for biostatistics, I'll show you the curriculum plan in the next slide. We have 6 core courses for 19 credits. Each of the core courses is a prerequisite course in the 5 disciplines of public health: biostatistics, epidemiology, environmental health sciences, health policy and management has 2 of the core courses, and social behavioral science has the other. So the 6 core courses for 19 credits. You have 5 specialty courses, 3 credits each for a total of 15. There are opportunities for 2 electives, okay, for 6 credits. And the electives can be taken in other departments across the university. So the biostatisticians might take courses in math or other, okay? And then finally, there's a practicum experience, a 300 contact hour practicum experience, which is generally an applied community-based program. Many of our biostatistics students will do a secondary analysis of public health data from large databases or large data sets. And so this is an attractive component to the curriculum because students are able to, analyze data in a practical sense, and then they become very employable afterwards. And finally, the last piece is a comprehensive exam everyone has to take. It's pass-fail, satisfactory, and so there's a component that covers the core, and then a component that covers the specialty courses. So this is the sample curriculum for Biostatistics MPH. In the fall semester of the first year, it's a 2-year program. In the fall semester, you start with the basic biostatistics and fundamentals of public health course, which we call EPI 1. In the spring semester, you take applied regression analysis and principles of epidemiologic research, which is EPI 2. So then together with those courses, you fill in with other core courses. okay? And then in the second year, you take experimental designs along with longitudinal analysis and another cohort. And then lastly, survival analysis in public health. You begin your practicum experience, that's the 300 contact hour applied project. And that will complete the 46 credits of the curriculum. So the good thing about biostatistics, as well as epidemiology, is it ranks within the top 12, biostatistics being number 1 of the best master's degrees for jobs in 2016, at least in the United States. So biostatistics, as you see, is high paying, starting out in $69,000 and mid-career about $104,000, and of high satisfaction as well. The same goes for epidemiology within public health. So these two specializations, I believe, are the top within the 5 disciplines of public health. Next. The goal in health sciences is to improve the health of the whole population. But if we can't access everyone, we can use statistics to estimate the result of a sample. So this is the reason why you use a sample versus a population, and you're making inferences, using statistics to make inferences for the population as a whole. However, it's important to have a sufficient sample size in order to have a valid result. Next. Why use statistics? Well, you can use descriptive statistics and inferential statistics. Descriptive statistics identify patterns, summarize information, leads to the generation of a hypothesis. Of course, not all research involves hypotheses, but typically when you have well-designed studies, you're developing a research question followed by developing a hypothesis, and then with differential statistics, you can distinguish true differences from random variation, and this allows for hypothesis testing. Next. So we have the population, we're developing a sample, producing the data, obtaining the data, conduct analyses to determine probability of outcome, and then infer back to the population. So manage data, analysis of data, and then determining the probability and inference that this effect will translate from your sample to the population. Next. Biostatisticians, as I mentioned before, work closely with epidemiologists. Epidemiology is the study of the distribution and determinants of health-related states or events in human populations. In other words, prevention and control of communicable and non-communicable diseases. I like to refer to it basically to determine risk factors for communicable and non-communicable diseases. Epidemiologists are also important in curbing outbreaks of infectious diseases. They're important in infection control in hospital systems. So very, very many duties and responsibilities of an epidemiologist. And in my opinion, epidemiology is the cornerstone of public health because it's so important, so flexible. All agencies need epidemiologists. Health departments, whether it's city, county, state, federal, and of course the gold standard for all of our epidemiology students in the College of Public Health is I want to become an epidemiologist at the Centers for Disease Control and Prevention. Well, we do have a case or two of those types of individuals who are the cream of the crop. But yes, it's very easy to find a job. Primarily, and one of the advantages we have, we're so good at training students to be data analysts, and everybody needs individuals that can analyze data. Next. All study designs have merit, but those closer to the top of the pyramid are more robust. biostatistical methods are tailored to study type, variable type, and the research question being addressed. Okay, so you can see here in the pyramid, at the bottom of the pyramid, it starts with case report. Well, many people will argue that a case report really is not research. And in fact, it's beyond the purview of the IRB, or the Institutional Review Board. Okay, a case report is just reporting an unusual disease state or a unique pathology in a patient. Okay, so that really does not involve research per se. You can go ahead and publish it without passing it through the IRB. However, when you're using multiple individuals that have demonstrated the same unique pathology or unique disease symptom or state, you have a case series. And when you study those individuals, that is research. And so you develop a study design based on a case series. A cross-sectional study depends what you're looking for. Sometimes people say a cross-sectional study design is a limitation. That's, our faculty are always quizzing students, you know, why are you only doing a cross-sectional study? As you know, a cross-sectional study is actually a snapshot in one point in time, and will give you a percentage and a prevalence rate. But the typical response, or where they're leading the student, is, well, let's design a longitudinal study. We'll get more information from a longitudinal study. And these other studies, case control, cohort study, non-randomized trial, and randomized controlled trial, are examples of longitudinal studies that are well designed. And meta-analyses or systematic analyses are tertiary type studies that will even more give you information with regard to the question at hand. Examples of important research studies in health sciences, and I'm sure you've recognized some of these. A case series studies was critical to identifying what became known as AIDS and to generating hypotheses for studies that followed. And there was a recognition of pneumocystis pneumonia in Los Angeles back in the early 1980s. And you can see here, these were individual patients. There are 5 patients here, patient 1 through 5, each representing a case report. Not so much as research, okay? But when you do a case series, you're looking at the sample as a whole, and you can get some result that will be meaningful to you in defining an outcome. As I mentioned, cross-sectional studies are important to understanding national trends, identifying new hypotheses, and acquire specific statistical methods. So you can see here, you may be familiar with the National Family Health Survey in India, which dealt with HIV prevalence in various regions and states throughout India. There's the Surveillance Epidemiology and End Result study in the United States, European Statistical System, and this large database for health statistics. Our faculty in the biostatistics discipline work with our students to do secondary data analyses with this large database in determining effects on potential outcomes later on in a secondary data analysis. Next. Groundbreaking studies that have changed prevention and treatment in health sciences. British Medical Journal. And by the way, I want to make a comment whether these studies you would consider important or not. First, ensure that the research and the manuscript is peer-reviewed. The report should be peer-reviewed in reliable journals. And then you might look and see the impact factor of the respective journals. Then, by reading those articles, you should look for how well the study was designed, how well the data were interpreted and analyzed, were the methods reliable and appropriate, And were there any limitations to the study? There really should be limitations in all studies. And most good papers talk about the limitations of the study at the end, along with the conclusions and recommendations. So the British Medical Journal, back in the 1956, identified the association of lung cancer and other causes of death in relation to smoking. So the effects of smoking on lung cancer were first reported back in the 50s. Next. There are several longitudinal studies that have gone on for decades, one of which is the Framingham heart study. Okay, involved a population in Framingham, Massachusetts that went on for 20 years, and they looked at the prognosis after initial myocardial infarction and showed that the survival rates decreased, particularly among men with myocardial infarction, much more severe effects than if it was just angina pectoris. So this is another famous longitudinal study dealing with cardiovascular disease. The Multicenter AIDS Cohort study, risk factors and progression in HIV/AIDS. And this is the risk factors for seroconversion to human deficiency virus among male homosexuals. And this was published in The Lancet back in 1987. So far we've talked about the British Medical Journal, we've talked about The Lancet, both highly reputable journals, so we're okay with that regard. Anyway, now this is called men who have sex with men rather than male homosexuals. And so this is a large study with 2,500 men, and they showed a correlation and determined risk factors with that population. Women's Health Initiative and Hormone Replacement Therapy. This was a very interesting study published in the Journal of the American Medical Association, or JAMA, back in 2002. Risk and benefits of estrogen plus progestin in healthy postmenopausal women. So the presumption was that you can use progestin together with estrogen because it would decrease the chances of breast cancer. But what they found was that with that combination therapy, you would have an increased risk for coronary heart disease. So in the effort to do good, they actually increased harm to the study population, unbeknownst to the researchers. So in this case, they had to end the study early. And that's not what you'd want to do, but that's a good bioethical concerns where you realize that you were causing more harm than good when you look at that risk-benefit ratio, and that's important. And so they had to end the study early. Next. Okay. Oswaldo Cruz Foundation. It's the preeminent public health institution in Brazil. This is one of Kent State's international partners. We developed the international partnership back in 2015. I've taken 2 student groups to the Oswaldo Cruz Foundation in 2016 and 2017 for the last 2 weeks of May. We spend the first week in Rio de Janeiro, Brazil. The students are lectured by scientists at the headquarters at the Oswaldo Cruz Foundation. Of course, we have several days for tourism and fun. The students stay 1 block off of Copacabana Beach, so they get to go to the beach. We spend the second week up in the Oswaldo Cruz site in Manaus, which is in the Amazon region of Brazil. Entirely unique tropical disease features in that region, where there's malaria, arboviruses like Zika, dengue, yellow fever, HIV/AIDS, and they're even looking at poisonous snake bites now to study, in terms of antivenom and how to ameliorate the lesions caused by poisonous snakes. So, back. This is the headquarters of Oswaldo Cruz Foundation. It's a Moorish castle and very unique architecture. So it has like a little museum with Oswaldo Cruz, Carlos Chagas. If you're familiar with one of the neglected tropical diseases, Chagas disease caused by Trypanosoma cruzi, it's very important in Latin America and the most common cause of cardiac disease in Latin America. But this is where those scientists originated. Next. This is my group of 15 students that traveled to the Oswaldo's Cruz and study abroad in 2016. These two here, this is a Brazilian student, got from Sao Paulo, got her MPH in epidemiology. Now she's doing her PhD at the University in Sao Paulo. This student here, an MPH epidemiology graduate from Kent State, now working at the University of Arizona Health Sciences Center as a senior clinical coordinator for large clinical trials at multiple sites in Africa, doing international kidney study. So the point I'm making is we educate our students in global health. They have a variety of experiences and become employable with valuable experience that they can take into their next position. So, at the time we were at Oswaldo Cruz in 2015, it was in May, just after the World Cup and just before the Olympics. So if you're working in this area, you know that there was an outbreak of Zika virus at that point in time. Outbreaks started after the World Cup, thought to be brought in from Uganda or Africa by one of the participants or such at the World Cup, and started the outbreak and went all over the Americas. And so you can see here that arboviruses such as dengue, chikungunya, and Zika are all transmitted by the Aedes aegypti and Albopictus mosquito, get a fever within 3 to 4 days, a rash in 5 days, joint pain, and muscle ache, okay? But the symptoms in pregnant women, or the outcomes in pregnant women, are much more severe. Next. So this is the natural history. First discovered in 1946, outbreak in northern East Brazil in 2015. Symptoms seen in 20% of infected persons. The other 80% are non-symptomatic, but there's no treatment and no vaccine. Mainly mosquito-borne. There's sexual transmission as well. But the sad part about this disease is that 29% of infected pregnant women have fetal abnormalities. We normally hear about, through the press, microcephaly, or the small heads, but things are much more severe than that. This ranges from fetal microcephaly to fetal death, increased severity, brain lesions, etc. So that impairs growth of brain cells. Next. So in the New England Journal of Medicine, published back in 2016 on March 4th, excuse me, the group in the Oswaldo Cruz Foundation published a report, preliminary report, on Zika virus infection in pregnant women in Rio de Janeiro. Next. Hopefully that. And this is basically the abstract. This is a cohort study. A total of 88 women were enrolled. 72 tested positive for Zika. These were pregnant women. They went to the acute Zika infection clinic, and the pregnant women ranged from 5 to 38 weeks gestation. basically, the bottom line is fetal abnormalities were detected via ultrasonography in 12 of the 42 women. Fetal abnormalities, okay, this represented 29%. And adverse findings included fetal deaths at 36 and 38 weeks, in utero growth restriction with or without macrocephaly, ventricular calcifications for the CNS, lesions, abnormal amniotic fluid volume, and fetal death, ultimately in some. So very grave outcomes, as it says here, but fortunately you have competent researchers that were able to carry out well-controlled studies that will give you important results that the whole world can use. Next. So, besides the lecture on Zika and the studies on Zika that we heard at the Oswaldo Cruz Foundation, there was also another study called the Brazilian Longitudinal Study of Adult Health, very similar design to some of those other studies that were 2 decades long with follow-up, etc. And so in this particular study, they were looking at biological, social, and occupational determinants of cardiovascular diseases. Various strengths of this study. Why this cohort study? Chronic non-communicable diseases are a global health problem. And about 60% of the global burden of disease is non-communicable disease worldwide. In Brazil, it represents 72% of all deaths due to cardiovascular disease in a relatively young population. Next. And you can see here the trend from underweight to overweight as we go through the years, and obesity increasing, both for male and female. So with that trend, they said we need to carry out a study that will give us some important information. Next. So, ongoing demographic, nutritional, and epidemiological changes were happening in an area of high social inequalities. So as we'll see in the study design, these were 15,000 participants from 6 major cities in Brazil. Brazil, I think in terms of the economic situation, similar to India, high middle, I think we are middle, high middle income. However, Brazil is a country of extremes. You have rich, and poor. I think I read in the paper, inequality is increasing from 1980 on in India as well. So this is a situation that is evident here. Next. Most of our knowledge about the etiology of chronic non-communicable disease comes from large cohort studies conducted in the U.S. and Western countries. So this represents a lot of the studies that were carried out, really served as an inspiration for the Brazilian researchers. Here's the Framingham heart study that I mentioned before. The study of Latinos in Miami carried out, and various others focusing on arteriosclerosis, et cetera, et cetera. So this lists major global and national epidemiologic studies of cardiovascular diseases, and you have, beginning in 2008, the study in Brazil involving 15,000 government employees, ages 35 to 74 years of age. So the idea is to investigate the incidence and progression of diabetes and cardiovascular diseases. They're not just looking at biomarkers, taking blood samples and urine samples, but they're looking at all factors that might be associated with outcome. Next. So this shows you that the 6 states, 6 capital cities across Brazil, multi-center cohort study, that's the design, large 15,000 participants. Next. And then they collected 28 aliquots per participant for future study involving even DNA for molecular studies. Okay. So there are basically two articles that are very important that serve as the basis for this study. The Objectives in Design, published in 2012 in the American Journal of Epidemiology, and then the cohort profile of this longitudinal study, published in the International Journal of Epidemiology in 2015. So the study has been conducted, or will be conducted, in 3 waves. They've gone through waves 1 and 2 thus far. The baseline from 2008 to 2010. Wave 2, which was just completed when we visited there with our group in 2016. These participants were invited to return, getting an update on exposures and identity changes and health parameters. And then they're just now beginning wave 3 with further follow-up. You know, obviously you're going to have a lot to follow up because people die and there are other conditions, characteristics. Data are collected in approximately 5 hours per wave. Quality assurance. Now, ethics committee approval obviously is a big chore because you have to get approval at the local level at each site, and then you have to get a federal approval as well. And then all of these quality assurance aspects are conducted. So there's a lot of work and a lot of effort that goes into this type of study. And questionnaires, wide range of items, and in addition to collection of biological samples, health and medical history, occupation history, reproductive health, psychosocial factors, food consumption, smoking, cognitive function, mental health. So they're really looking at social and health disparities, social conditions, social determinants of health. That's a big focus for a lot of people in public health, social determinants of health. So they're looking at persons with different racial backgrounds, different ethnicities, and in this particular study. Next. And very detailed cardiovascular measurements as well. Next. Looking at glycemic indexes, with the major focus is diabetes. 6 research centers here in the area. Okay, I would like to end the talk with a study conducted by one of my PhD students who graduated with a PhD in epidemiology at Kent State in December 2016. Community context and sub-neighborhood scale detail to explain dengue, chikungunya, and Zika patterns in Cali, Colombia. Okay, she lived and worked in Cali, Colombia, ended up marrying a Colombian guy who was working at a research institute there. As you see, she got a nice position after she graduated at Stanford University School of Medicine. What she did was in epidemiological epidemiological modeling using case data for dengue, chikungunya, and Zika in Cali, Colombia, and associating that with geospatial mapping using GIS technology, Geographic Informational System, using a kind of unique offshoot of that technology to get her results next. And this was published in PLOS ONE journal. It's a renowned online public access journal. Not only she was a student in our department, but we had collaborators from the Department of Geography at Kent State that provided the GIS technology, and then the clinical support from institutions, clinics in Cali, Colombia that provided the case data as well. That were part of the geospatial mapping, and we're able to determine hotspots in Zika areas of concern there in Colombia, and ultimately resulted in risk maps with local context for leveraging increased control, efficiency, targeting key areas of environmental risk. Next. So you can see what you can determine with the spatial video risk. So there's cameras that are mounted on vehicles, and you drive around the areas and you take video, and you can look at potential breeding sites and vulnerable human activity. So here's a potential breeding site here, and you can correlate that with case data from that district. So here is the camera. You're looking at a canal here with potential breeding sites. Next. And this is what you come out with, the geospatial interview transcripts, where you interview residents in the neighborhood, and you can see the word cloud, mosquito, look, lot, canal in the neighborhood. And so you can make inferences from themes that come out in this particular type of study. So, College of Public Health at Kent State. Training at the undergraduate and graduate levels in public health disciplines. We focus on evidence-based public health practice in domestic and international communities through effective collaborations and partnerships. And I hope that we can work closely with SGT University as we move forward in the future. The College of Public Health students and faculty have educational and research opportunities globally, studying communicable and non-communicable diseases. And our graduates are competent public health professionals with demonstrated success in finding worthwhile positions with hospital systems and public health institutions. Next. So we look forward to welcoming you at Kent State University. So I thank you for your attendance and participation. Thank you very much. I'd be glad to entertain any questions that you might have. Anything at all?
Any of, especially the postgraduates related to public health, social medicine and public health dentistry? Anything you would want to ask, sir, on how we can proceed with some global health policy making, global health programs? Because sir is an expert on that as well.
If you don't feel like asking the question now, that's fine. Your lab chiefs, your administrators have my contact information, so you can always email me, and I'm very responsive to emails, so we can talk by that communication. Okay.
Kriti, you would want to ask sir something about cleft?
Yes, sir.
So we are working on we have a cleft palate center here at the university. So that is one area she...
Maybe just something about the survey design that we're talking about.
Good morning, sir.
Hi.
So we have actually opened a cleft center here about a couple of months back. And so cleft lip and palate is quite prevalent in India particularly. The global incidence is about 1 in 700. But there are pockets where the cleft lip and palate is seen more frequently. So we were planning on conducting a survey because incidence studies are not very elaborate that have been done till now. So there's only a couple of studies which have focused on some localities surrounding some centers. So we were interested in designing a multi-state kind of a survey. So if you could just help us chart out a survey design as to how to go about the survey for this.
Well, you need to talk with an expert in survey design and qualitative studies and get the appropriate questions and appropriate ways to analyze the data. I talked about biostatistics. We train our students very much in how to manage and analyze data by using SAS software, SAS. But I don't think you need to use such a sophisticated theoretical-based research tool for that kind of study.
you should be able to analyze it using SPSS or something more basic. Since that's so common, relatively common, I would say you would not design a case series because people know about this. So maybe something like a cohort study or a case control study where you have those with the cleft palate and those with not. And then it would be nice to do a multi-center study where you look at different regions. Are you thinking about within this district or?
We're thinking more of the northern
Part of India?
northern part of the country. Yes.
Okay. So you look at different geographical sites to see if there are differences. And then anticipate different causes, whether you know more than I do, but whether it's strictly genetic or whether there's some environmental factors involved. And so, based upon your basic knowledge of the cleft palate, then that's how you begin constructing your survey. But you know, you can use a basic, could be like the person would be like self-reporting. So it'd be, you can use a basic Likert scale, and there's ways to interpret data from a Likert scale, but then you can get a little bit more involved as well with logistical regression and things like that. So if you need outside help in how to design your survey, I know people who can provide that, although I'm not the one to do that. Okay? Thank you.
Many minds would have benefited today after this wonderful presentation. On behalf of the management, faculty and the students, I would like to thank Dr. Mark A. James for sharing his knowledge with us today. To conclude the ceremony today, I would like to propose the vote of thanks. It's an honor for me to be standing here and proposing a vote of thanks to acknowledge the efforts behind the organization of today's event. At the foremost, we would like to thank our managing trustee, Shriman Mohan Singh Chawla, and chairperson, Srimati Madhupreet Kaur Chawla ma'am, for their visionary guidance and support to organize such activities. The mentoring of our Chancellor, Shri Ram Bahadur Rai sir, and Dr. T.D. Dogra, Professor Anthropology and Education Philosophy and Professor Emeritus of Forensic Medicine Sciences, Pro-Chancellor Sir Dr. Shamlal Singla, always a guiding force behind our endeavors. We thank you, sir, for this. We thank the simplicity and precision of our Vice Chancellor Sir Dr. I.J.S. Mann and Pro-Vice Chancellor Sir Dr. Dalip Singh and our Registrar Sir Dr. P, who have always supported all the activities organized at Faculty of Dental Sciences. Other university administrative officers have been instrumental in our efforts, especially Dr. M.S. Sidhu, Dr. H.S. Grover, Dr. Dayal Shankar and Dr. Suma ma'am. We thank you all for guiding us always. The torchbearer of our faculty, Dr. Anil Gupta sir, has been an inspiring force to support us in all our activities at all departments. We thank you, sir, for your guidance. I would like to express our sincere thanks to Dr. Mark A. James for giving an excellent coverage to role of biostatistics and research methodology in health sciences. We are all inspired by your great work, sir. I also like to thank Mr. Nitin Wadhwa for their collaboration on guest lecture and opening doors of Kent State University for SGT College as creating maximum opportunity needed for. I thank all the heads of various departments and the faculty members for their support. I'd also like to thank Indian Association of Public Health Dentistry for the constant support and guidance. I would be failing in my duty if I don't say a special thanks to the supporting staff at the university level, especially designing department, audiovisual department from mass communication, Mr. Sohan from administration and his team at dental office who have been very supportive to us in our endeavor. Last but not the least, I would like to thank our own team of faculty members at the Department of Public Health Dentistry, starting with Dr. Shaurya Tandon, without whom this session would not have been possible, Dr. Sachin Chand and Dr. Neha for constant support and guidance, our postgraduate students, interns and non-teaching staff who have worked hard to ensure that this event becomes a memorable one. Once again, I thank one and all. Greetings and have a good day. Thank you.